So I think, we forget of that pharmacokinetics aren't just monitoring your vancomycin or your aminoglycosides. It's the whole ADME principles. In regards to absorption, if you know certain things affect drug absorption, you can maximize patient outcomes by affecting these. So specifically in infectious diseases, we have a drug called itraconazole that needs an acidic environment. So maybe tell your patients not to take their PPIs or their other medications and acids that could affect this, or tell them something as simple as drink it with a Coke. It's the same thing for distribution or metabolism. There are plenty of drug-drug interactions that your everyday pharmacist is going to see while they're working, or even something as simple as renal dosage adjustments. It's not just your vancomycin and aminoglycosides.
But should you have to deal with any of your vancomycin or aminoglycosides, typically a staff pharmacist, at least what I've seen, is that when the clinical pharmacists leave for the day, your staff pharmacists are now responsible for conducting all of the rest of the vancomycin and aminoglycosides and even warfarin dose adjustments that happen off shift. And so if you ever work in a PM shift or even overnight, you may have to be responsible still for knowing how to dose adjust or start regimens for vanc, aminoglycosides, and warfarin.
And that even applies on the community side of things. You can get a prescription for someone, they have 80 milligrams of Lasix BID. You should know from your pharmacy education that this person has renal impairment. They also present with a script for levofloxacin 750 daily. You know that that drug needs to be renally adjusted. So we have a mismatch with these prescriptions and their renal function. So that should prompt you to call the doctor and figure out what you need to do for this patient. I would not want to send that patient with both their Lasix script and this levofloxacin script knowing that they have a renal problem.
Or again, even something as simple as drug interactions. Pretty much most patients are taking a daily multivitamin. Knowing how those impact or combine to a lot of the antibiotics, making them potentially less effective, and all you have to do is say, hey, maybe hold off on your multivitamin for a week.
Yeah. Also iron, and you want to take it on an acidic stomach. So if they're taking a PPI, there's another drug-drug interaction you need to be aware of. Or you can tell them to take it with orange juice. It might make it more effective. So there's all sorts of kinetic properties we need to know about.